Hi, it's Nicole, the Crony Mom, and today I wanted to talk about hospitalizations. So, when I was first diagnosed with Crohn's, I was put on medications, and yeah, I was not doing well, but I was coping at home, and I was kind of making it work. And it wasn't until probably 6 months after I was diagnosed, I ended up in the hospital for the first time due to my Crohn's. I was severely dehydrated. I was anemic. I was out of it. I was living with my mom and dad at the time, and it was actually Easter Sunday, and my mom came down, and I said, I can't go to church. I just can't get ready. I don't feel good. I can't go. And she said, no, get dressed. And I said, I can't. I don't feel good. I'm staying in bed. And I had been basically homebound for a week, hadn't really done much. I only really left my room to go to the bathroom. My mom would try and give me food to eat, and I just wasn't eating. I was drinking water and Propel, I think at the time, maybe some Gatorade or Powerade, but I really wasn't eating much because it hurt when I ate, and I was just in pain all the time. And so she came down and she said, no, get dressed, we're going to the hospital. And I started pretty much yelling at her and going, no, I don't need to. Why would I do that? That's stupid. And she called at the time he was my boyfriend, but he's my husband now, and said, we're taking her in here, you talk to her. And I was, same thing. I was like, no, I'm not going. And I threw the phone. And looking back now, it was because I was almost essentially delirious. I was not in a good frame of mind because I was so dehydrated and so anemic. So that hospital stay, I want to say it was about 5 days, maybe a week. I'm not positive. I did need a blood transfusion because of how anemic I was. Lots of fluids. I honestly don't remember if I needed to replace my magnesium, potassium, or anything like that. Honestly, I don't remember. But everything went smoothly, and I went home and recovered. I was very weak after that, though. It took a lot for me to gain back strength, and I kind of had to slowly work my way back into real life. So that was my very first hospital stay. And then I wouldn't have another hospital stay until I had another visit. I actually ended up having a perirectal abscess, but I had surgery that night. I went into my doctor, my GP, regular family doctor, and he said, you have an abscess, you need to go to the ER. So I went to the ER, probably got there about 4:30. That night I had surgery, and I actually got to go home. So I didn't even have to spend the night, and that was healed up really easy and fast and fairly painless. I mean, it was painful in the beginning, but after the surgery it was fine. And then fast forward, my next hospital stay would be when I had my colon removed for my surgery. So my surgery was essentially emergency. It was not planned. I did not know what was happening. I actually thought it was an ovarian cyst. But no, I had my colon removed, and I spent close to 2 weeks. 2 weeks in the hospital recovering from that. And then after I had my ileostomy placed, I was good for about 3.5, close to 4, no, it was more like 4 years. I was good. I was just living life, and I was a little careful about what I ate, but for the most part, I could, I don't want to say normal, but I was typical, and I just did my thing. So then that will bring us up to last April, so April of 2017. I take that back. About 2 years ago now, I had a kidney stone. Yep. So I was in the hospital for that. I also had one hospital stay where, so my kidneys are being affected because of my ileostomy and chronic dehydration. So I had a nephrologist. We tried a weekend in the hospital of just doing fluids. I just sat there with an IV all weekend, and it helped, but it's not a, like, that's no way to live. Well, essentially. So there was a stay for that. There was one other stay where I was just severely dehydrated and needed fluids and potassium and magnesium supplements. But they were always like a day or two, 2 days, 3 days max. So then come April of 2017, and I started getting blockages in my small intestine. And they were, what did I spend? Probably I've been in the hospital maybe 5 or 6 times in the past 6-ish months due to blockages. And for the most part, they are all very pleasant stays, except for this last one a couple weeks ago. I wasn't feeling well, and I tried to sleep it off. I tried the heating pad. That didn't work, and I started vomiting. So I have found that it is easier to drive myself to the hospital because then I have a vehicle there, and when I'm discharged, I can go home. So I don't have to sit around and wait for one of my family members to come pick me up. So I drove myself in, or almost every time. There were a couple times I didn't, but for the most part, I drive myself in. I go to the ER. They do a CT of some sort. Sometimes I can have the contrast. Sometimes, because of my creatinine level and my kidney function, I cannot have the contrast. But either way, my blockages are pretty bad that they can see something. There was one time, not too long ago, about a month and a half ago or so, I went in. I did have a obstruction or a blockage. It showed up on a CT scan. And as I was waiting to be admitted, the hospital I was at was full, and I was going to be transported to a neighboring hospital, another local hospital, not very far away. In that time, the blockage passed. So I don't know if it's just rest, pain meds, and fluids, but it released, and they let me go that night. So that was good. That was just an ER visit then, and an admission averted. But I really want to talk about this last hospital stay, because all my other hospital stays, I have had zero issues. Maybe a little annoyed because they've kept me maybe longer than I think I should be there, but nothing like crazy. However, 2 weeks, almost 3 weeks ago now, I had a blockage. I did a CT scan. So I went in on Sunday night at about 7 o'clock. I drove myself. I was given Zofran and Dilaudid right away, which was amazing. It helped. I didn't vomit after I had 2 doses of Zofran, which is anti-nausea medication if you're not familiar. After that, I did not vomit at all, which is really good for me. So they did a CT, and I was admitted that night. I finally got in my room about 1:30 in the morning on technically Monday morning. And when the internalist doctor came in on Monday morning, he said, and I quote, "Your CT scan is impressive." Those aren't words you typically want to hear. So he showed me, and my small intestine was so, I don't even know if you call it bloated or distended. It was big, and it almost looked cartoonish. It was disgusting. I had food, bile, stomach acid, stuff, gunk, poop, whatever, backed up all the way to my stomach. He was shocked that I was not throwing up, and he was shocked that I did not need a NG tube. He really thought before he walked in and met me that I would be vomiting all over the place and that I would need a NG tube down my nose. And I've had that once, and I really, really don't ever want it again. It was a pretty painful experience for myself. Some people have them and have no issues. I just was super uncomfortable. It hurt. Everything hurt, and I was miserable. So he showed me my CT, and nothing had moved as of 8 o'clock Monday morning. So we were just going to wait on that and let the GI team kind of figure things out. So the GI doctor on call was actually the doctor that diagnosed me. I did not have a pleasant experience the last time I had seen him when he diagnosed me. My very first colonoscopy was very painful, very uncomfortable. I was crying, I was screaming. They gave me so much Versed that I was out, that I don't remember most of it, thankfully. But the part I do remember was not fun. And he just didn't have what I think to be a very good bedside manner. And he wasn't like caring, compassionate. I didn't feel anything. He was very, he poked his head in the curtain after my scope and said, "You have Crohn's," and walked away. So that was the last time I'd seen him. So now I see his name on my board in the hospital, and I am not excited. No. So Monday afternoon, I fell asleep because, again, I was admitted into my room about 1:30, so I didn't sleep much, and so I was asleep, and he grabbed my foot, like my big toe, and shook my big toe to wake me up. Yeah, that was nice. So that's a nice wake up. And so I wake up, and he's like, "Okay, well, you're backed up, and blah, 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 blah. It's obstruction, blah, blah, blah. And is anything moving?" And I was still kind of asleep, and I'm like, "No." "Okay, well, we'll just let things go. No NPO, nothing by mouth, or just some ice chips." And yeah. So then he leaves the room, and I'm kind of waking up again, and I realize I have output in my ostomy, and I was super excited because that means things are moving. Let's get some clear liquids in me. Let's do full liquids. Let's get me out of here. So I unplug my IV. I run out in the hallway to find him, and I'm like, "I have output. Things are moving. The obstruction's passed." And he's like, "Okay." I'm like, "Come on, I need you to be excited." I walked away, and so that was that. That was it. I think he did let me have clear liquids after that, because I think I got some water. Did I? No, I could just drink water at that point. So then that was Monday. Tuesday morning. So besides the GI doctor I see, they also have physician's assistants and nurse practitioners that help out in the hospital. So I saw one of the PAs, and both are amazing at my hospital. I love them. So I saw her, and she said she talked to my regular GI that I see in the clinic a lot, or all the time, like my doctor, and they want to do a scope because they're not set that this is inflammation. It's just the reoccurring, and they are wondering if there's some stricturing. I say okay. So that was scheduled for the next morning on Wednesday. So I did have to drink a prep. It's just the Miralax prep. And because I had been so backed up from the obstruction, I ended up, because she said I could stop once things ran clear, but I was so backed up, I had to drink the whole thing. And if you've ever done the Miralax prep, it just tastes like the Gatorade you mix it in. So to me, it's not a big deal. It's just a lot to drink, and you want to drink it in a short amount of time. So it's just a little uncomfortable and like full feeling, but it's not, I don't have to run to the bathroom because I have my ostomy bag. So it's way better than a colonoscopy prep, in my opinion. Let's see. So we decide to do the prep, I do the prep. The next morning, I go down to the procedural care, which is where they do the different procedures, I guess. And we're waiting and waiting for him to come in, and waiting. He finally comes in, and he takes the blanket off of my stomach, and he looks down, and he goes, "Take it off." And I said, "Take what off?" And he's like, "Take that off." And he points at my ostomy. And I said, "I didn't bring any supplies down. They're all upstairs in my room. I didn't think you would take it off." And he goes, "Well, how am I going to get it in there then?" Like, well, my doctor goes through the bag. I have an open, like it opens. Hello. And he goes, "Well, there's stuff in there." And I said, "Well, I can empty it." And so thankfully the two nurses that were in there were amazing, and one came over with a graduated cylinder and helped me empty it, and he starts like giving me the digital exam, which is sticking his finger in my stoma, which I don't know why, but that freaks me out. Didn't even have any anesthesia or anything, and I said, don't I get medication? And he goes, oh yeah, give her a shot of Versed, or whatever dosage of Versed. I'm like, that's it? I'm used to propofol, and I'm used to being knocked out completely during my scopes and not remembering anything. So I get a shot of Versed, and I know for a little while I kind of go a little out of it because there's a little chunk, it was probably only seconds, or that I don't remember. And then I remember looking on the screen and watching my scope, and the doctor's all excited. And he's like, oh, it looks so good. Look there's less inflammation, and it's looking so good from your last one. And I'm not a happy camper. And I'm like, yeah, but there's 2 polyps, and that doesn't explain things. And are you taking biopsies? And I was kind of yelling at him, and I was not holding back. The Versed definitely helped all those emotions and feelings, and there was no biting of my tongue. Like, it all flew out. And he goes, yeah, we'll take biopsies, and the nurse, helps him with that, and they do that, and then he finishes, and he goes, well, this looks so good. I'm very happy to see this. And I said, but that doesn't explain why I'm here. Like, that doesn't explain. Can't you go further up? I think there's stricturing or something narrowing further up. And he goes, no, this is as far as your doctor went. This is as far as I'm going. I said, okay, because I know there are risks. The further up you go and the farther into the intestine, and it's windy, and I get it. I just want some answers because I am sick of this. Like, I've been on prednisone now since April. I mean, off and like, for the most part, off and on. I haven't weaned off. I've been on and it's too long. My body, I'm doing a bone density scan here too, but I'm kind of scared. So I was not very nice to him. And when he left, I kind of broke down and I started crying. And the nurses, were all concerned that I was in pain or something. And I said, no, I have a history with him, and I don't like him. And I'm really, so I was crying, and they were so sweet, and they gave me another blanket, and, I could tell that they don't really care for me either, but I know they can't say that because, all that stuff. But they were very sweet and tried to comfort me, and so then, let's see, they did let me have clear liquids then that night. So I had some chicken broth, Jello, like sherbet stuff, ice melt, whatever they call it. And then I saw the GI the next day. No, later that day. I was trying to bug the nurses to up my diet because I wanted, real food. And the doctor never responded. So Thursday morning, she came in right away, and she let me up it to a soft foods so I could eat. And they let me go home actually on a soft foods diet because that's what I'm going to eat when I come home. I know my body, I know my disease, and I know how to be careful and what I need to do. And thankfully, the PA and the internist doctor that I had trust that I know what I'm doing. So I think that's a big part of you need to advocate for yourself. You need to know your disease, know your body, and if not, ask questions. Don't feel, Google is great, but it's so broad sometimes, especially I feel with IBD. My Crohn's is very different than anyone else's Crohn's, and the way I react and the way my body acts with medications, with different things, is so different, and it's so individualized that I think you have to be your biggest advocate, and you need to do your homework and keep notes, keep track of how things work, and what happens when you're in the hospital, and different, I don't know. I just think you really need to stand up for yourself. You need to ask questions. You need to, voice your opinion. It's your body, first of all. And thankfully, 99.9% of the doctors that I have come across, listen to me and work with me. I think this past GI doctor is the only one that has really been an issue. I've lucked out. Nurses, sometimes they think they know, but I can get over that. Like, I can get over the like book smart kind of nurses, or the ones who know Crohn's like really well from the books. I can get over that. Like, but the doctor just being a jerk is whatever. So I'm glad I spoke up for myself. I then had an office visit with the PA that I typically see, and I told her all about this. So I will get like a questionnaire. My GI clinic sends out questionnaires, and the hospital does too. So I will not be afraid to let everyone who wants to listen know. I mean, obviously I'm putting this out there, but with his name and stuff on it, because that's not fair. And what if I couldn't speak up for myself and he just, I don't, I'm scared for other patients because I don't want anyone else being treated the way I was treated that day in that scope. And the GI that I typically see and the PA that I see in office, they do their rounds at a different hospital, which is 25 minutes away from my house, whereas the hospital I go to is 2 miles down the road. And I have thought about going to that other hospital so that I can see them. However, I have a 6-year-old, and Crohn's, hospitalizations, obstructions, they don't plan around our schedules. And his life needs to stay as normal as possible. He needs to be able to go to school. He needs to be able to see me if he wants to come visit. And when I go to the hospital down the road, that can happen. You know, my husband or my mom can pick him up from school, give him food, and then come visit me for, half an hour, depending on the night. So I love the rest of the team at that hospital, so it's just this one doctor. That sucks, but that's kind of, that's what I just wanted to get out on this video, is that to speak up for yourself, be your own advocate, and just know that hospital stays are something that are frequent for some people, and other people go years upon years of nothing. I thought, what do you mean hospital stays in the beginning? Because what do you mean? And then, oh, I have an ostomy. Oh, yay. It solved all my problems. No. So, unfortunately, hospital life is a norm for us in my family. It just is. I know what to bring. I know how the system works. I know what drugs I need, what scans I need, all that kind of fun stuff. So my suggestion is research, ask questions, try and understand your body and pay attention to your body. Take notes of what happens if you can, and, speak up for yourself. So if you have any questions, let me know down below and give me a thumbs up, and I will see you in the next one. Thanks. Bye.